Co-host of the Today's 101.9 morning show, and we want to welcome today Dr. Kenneth Fletcher. He is the head of the Division of Laryngology at GBMC and also a laryngologist at the Johns Hopkins Voice Center at GBMC. Thank you, Dr. Fletcher, for being here.
Thanks.
And also we have speech-language pathologist Melissa Bidlack, and she's from the Johns Hopkins Voice Center located at GBMC. And today we're going to be talking about voice problems and how to keep your voice healthy. And we want to thank everybody who submitted their questions in advance at facebook.com/GBMC Media. And throughout the show, feel free to continue to do so because the platform is yours and we're here to answer your questions. So we want to welcome you to do that if you haven't already. You guys ready to get started?
Sure.
Thank you for having us.
Oh gosh, thank you for being here. I'm so excited. This is fun. First up, little background, how do vocal cords actually work?
So the vocal cords themselves are just part of the way that we talk, but they're the thing that everybody thinks about. So essentially they are muscles that can open and close to regulate air coming in and out, and then they vibrate, and then the vibration upon them is very smooth. It gives us a nice good tone, much like a guitar string, and then we use that tone to then shape it into our voice with our mouth and our nose and all the different ways that our voice can change, whether we are ill or not. Everyone knows, how the sounds can be manipulated in that way. But the cords themselves are just that vibratory source to actually obtain that sound.
Cool, and I guess your average person that isn't a doctor wouldn't really be able to know what that looks like normally, right? You have to use an instrument to see that.
Correct. So we have, and what's really cool about what we do is we have essentially high-speed imaging that can look at the vibration of those vocal cords that are often at 100, 200 times a minute, and how they oscillate. And it's really cool at how we can see those details. And even other doctors obviously send them for us to look at because we have those tools. So
that's really cool. I can tell you guys are passionate about what you do. That's awesome. What are some of the most common vocal fold injuries that you come into contact with?
I think, obviously we see lots of things that people come in for being hoarse, but when you look at the vocal cords themselves, the things I think that people think about are what we see. So things like vocal cord nodules, vocal cord polyps, vocal cord hemorrhages. If you step back and think about the vocal cord just like any other part of the body, if you traumatize something, it may either get a callus or a blister, or it might get a bruise, and that's very similar to what we see.
And we hear that sometimes some of our favorite singers might go through that and have to cancel a tour.
Correct.
Or,
Absolutely.
or some radio host, for instance, might have to take keep it quiet for a little while.
Sure. Very similar to an athlete that twists their ankle. We see the same things that happen at that level.
There's a therapy involved, right? Which leads us right into our next question. Does voice therapy help, and what is involved in voice therapy?
It's a really great question. Voice therapy does help, but we have to meet some initial criteria before we embark on that journey. First, we'd want that patient to be seen by a laryngologist and have their vocal folds visualized. And then we'd decide together if we thought the diagnosis was appropriate for treatment. And if we, met those two criteria, then we'd embark on our journey. And it's really a team effort between me, the therapist, and I specialize in singing voice, and my patient. So they have to be invested in coming once a week for an hour for several weeks, and they're given homework, and we work on educating them about the voice, giving them some exercises to do to promote healing, and then helping them to keep their voice healthy for long term. And it can be really helpful.
That's really cool.
Yeah.
You think about it, doing your vocal exercises and the fact that you two do work in tandem.
Correct. And certainly things that people may think, oh, well, I need surgery or something to fix that, and often things that may look, I guess to some people think, well, that's the next step. And often these are very rehabilitative type things that they don't ever need me to intervene.
And that's a great point. We do go back and we say maybe there's a medication need, and we talk a lot, or at a certain point, maybe we've plateaued with therapy, so maybe there's a surgical need, but we do talk quite a bit.
Do you try to avoid the surgical angle? I mean, sometimes you can't avoid
Certainly.
that. Certainly.
It really, everybody is individual, so each patient, certainly you always hear that, and then the injuries are individual, but at your best, you would like to avoid any surgery.
Right.
No
In an
matter what
ideal
it is.
world, right?
Exactly. So, there are things that, we know that probably are going to benefit from surgery, but even those, we will often apply our therapeutic endeavors first so that we can make surgery that much better if you do need to embark upon it. But certainly if there are things that even we think, look, these have a remote chance of really making you better, we will try therapy first. You know, certainly it is non-invasive and, you know, has a lot less side effects. So
only drawback is time. And then if we know they're going to get a surgery, we're still preparing them for the voice habits they want to keep forever. So we will rehab them through, you know, after they finish their surgery if they do need it. But hopefully the things they learned before will help them recover a little better.
Good habits to have, for sure. And what types of professions, we mentioned singing voices, which you specialize in, Melissa, but which other professions are at hi, well, you wouldn't know that I actually use my voice for a living with that question, would you? But no, which professions are at an increased risk for vocal injury?
So you mentioned singers, actors, of course, any profession with a high vocal demand, a heavy vocal load. Teachers, music teachers are 4 times as likely to have a voice disorder. Broadcasters.
Right, who do twist up their words sometimes.
Pastors, preachers, even doctors and lawyers, right? People who do a lot of public speaking as well.
Right.
Yeah, and it's usually the ones with no training, right? I mean, so, you know, even the singers we think about, but a lot of times they have much more insight. So, you know, we see them kind of at a different level of problem versus folks that just have no insight about what they're doing with their voice, like doctors and people that just talk without thinking about it.
That's right. And we really wonder with some of those rock bands that used to have screaming singers how they were able to do that so long.
But many of them aren't still doing that.
Or they're doing it and it's different,
it's
right? If you
different.
listen to them when they were young versus now, you can hear changes in range and quality. Sometimes not across the board.
For sure, for sure. The trained ear that you have will definitely pick up on that. How can we take care of our voices to reduce any chance of injury? And if so, are there some home remedies that help out with that?
Well, I think that, you know, just like any other preventative strategies, you know, if you don't know what to look for, you may not know. So, you know, obviously things that you're doing that create pain, discomfort, you know, we say, look, those may not be the best ideas. So going out and screaming at every, you know, kid's game or football game and then being hoarse for a few days after, probably not very good things to be doing. So, you know, we see children sometimes that come in with voice problems and they're the ones that are loud and they're, you know, so it's reining in the overuse to some degree. And then all the things that make us very healthy anyway. So hydration, drinking lots of water, fluids, and, you know, this can be a very complicated answer, you know, depending on each individual need.
Sure.
But, you know, certainly it's a matter of when you do feel something's different, something's wrong, you know, potentially seeing your physician. You know, you don't have to start with us, but, you know, starting out and figuring out, you know, are there simple things like allergy or some other things that if you manage those very easily, then some of that can have a very positive effect. But then once some of those other problems that maybe you're trying to manage aren't managed so well, then, you know, maybe then having it evaluated and at least have an idea of what's going on.
Great, that's very helpful.
I'll add something to hydration.
Sure.
So the water we drink, not a lot of people know this, but doesn't touch our vocal folds. So it has to work its way through our system kind of indirectly. And so there are 2 ways to hydrate. There's the systemic hydration, you know, getting enough water every day, and that is a little bit different for each person. But then if you're really dry or mucousy, you can sometimes use topical hydration to supplement. It's a temporary fix, but that's like inhaling steamy, moist air, a hot shower, pot of water, or using a cool mist humidifier at night are ways to give yourself a little temporary boost of lubrication to the vocal folds. And when they vibrate better, then they're less prone to injury.
Wow, what a great idea. Those are things you don't have to necessarily go to the spa and get a steam room facial. A lot of these things are at home.
Totally. And the flip side is like knowing what things dry you out, smoke, alcohol, sometimes caffeine, right?
Yep.
Certain medications, which Dr. Fletcher could elaborate on.
Right, right. Is that something that they normally warn you about, those sorts of things, or a doctor should, or a specialist like you would?
Well, I think we warn folks a little bit just because we see the problems afterwards, and but you know, certainly things like antihistamines. A lot of I have this problem, I'm going to the drugstore on my own, you know, what is it? And what ends up happening sometimes is for allergy and such, you find yourself at the end of 5 different pills and you're maybe worse than where you started as far as dryness and different things. So we tend to at least look at, so for the singer or the voice user with allergy problems, for instance, we'll say, you know, manage the problem you're looking for. So if it's nasal congestion, you know, work on things that aim there rather than systemic. We see problems with, you know, folks using like oral decongestants and oral antihistamines. It'll thicken the mucus. It may make them more clear to breathe, but then make everything a little drier and stickier at the level of the cords.
Right.
And so you've tried to fix one problem, but you've kind of created another one. And for someone that's not using their voice, it may not be a big deal. And so sometimes even our management is subtractive. Hey, look, let's, you know, someone will come to us for, you know, we're the voice people, and then we just tweak their kind of sinus stuff, you know, by let's change you to a nasal steroid spray over an oral antihistamine, or tweak things just a little bit, and that's all we do to fix your voice problem.
Wow,
so,
I didn't realize that, because I'm a person that I will always have a stuffy nose if I don't take my allergy medicine every day, but I don't even know if it's okay to take that every day.
Well,
and it's like Zyrtec or any over-the-counter.
And every medicine has a little bit of a different effect on
Shades
every
of gray.
person. So,
Right.
you know, and again, if it's all working fairly well, then we don't tweak too much, but certainly if you're that person saying, look, I was fine until I started all this allergy management, then, you know, part of, anytime you're in medical school, they say the history and the physical, no matter what you're doing, is the most important part, with the history being first. So we review medicines, and, you know, we look at things, and, you know, if you really get a little deeper, people with other medical problems on like diuretics and medicines that dry you out, lots of medicines, dry mouth is a very common side effect. You know, we'll sometimes see patients with 20 medicines, and it is amazing how sometimes if you just go through and look at those, you can find the answer to all the questions as far as some of the feelings that they have. It's very difficult sometimes if they need to be on those medicines, but you can, you know, we'll work with their primary care doctor to potentially move things around and try to help. And it's neat because it's just simple things. You know?
Yeah, it's like putting the puzzle pieces together, right?
That's right.
And
Voice detectives.
Yeah, you're voice detectives. You really are. And Laura wrote in. She said, and you kind of covered this, Dr. Fletcher, when you were talking about kids raising their voices a little bit, or just overusing their voices. But she writes, after a Ravens game, my husband comes home with no voice. Is there any way to protect his voice from this during the season? And he's also a teacher, which is one of the professions that we mentioned earlier. So he uses his voice all day, every day, combined with that in tandem with the Ravens' spiritedness. How do you help that?
You know, I think that sort of the thought behind that is thinking of your voice as just like any other part of your body. So that same question can be as, you know, he plays pickup ball every day, you know, with the kids, you know, for several hours at a high end, and then plays every day, you know, and now he's having shoulder problems. You know, we'd all think, well, he needs to rest that a little bit. He needs to maybe think about his technique a little bit, and maybe, you know, don't overdo it so much. And so when we think about it from the same point from the voice, you know, teaching is very tough on the voice. So you have to take that all by yourself and say, okay, what are you doing in the classroom? Do you have your classroom set up? You know, are you having to yell to the kids at the back of the room? Do you have amplification if you can have that, which is very important. I think a lot of people just get by, you know, and maybe they even have the microphone in the, you know, in the drawer and they don't use it. I think a lot of times those schools don't necessarily have that, so then it's a matter of, okay, I set my class up so that the kids are close to me and in a round table discussion, all these little things that you tweak so that you're not having to overdo the voice every day. So then when he wants to go to the Ravens game, you know, we talked about this a little bit before, is there a safe amount of screaming? When I see that, I'm like, well, no. I mean, you know, that's, again, that's an extreme overdoing. There are some techniques that, you know, our voice therapists do work with. Okay, if you do need to raise your voice in a healthy way, and Melissa maybe can talk about that a little bit, but, you know, in general, just be wise about overdoing it.
Yeah, we talk about vocal extremes, which we call phonotraumatic, meaning injurious to the voice behaviors, right? And those are things which cause increased vocal fold collision, right? So the force of those vocal folds coming together is very harsh. So things that do that include coughing, throat clearing, screaming, yelling, cheering, right? Singing in extreme upper ranges, especially if you're not trained, perhaps just untrained singing, right?
Oh, what about car singing? Oh my gosh, what if your favorite song comes on the radio?
Well, if it's not in your range, you might be overdoing it.
Wow, I didn't, you know what, thank you. This is helpful for everybody, right?
But you know, you're right, but when we teach people to be louder, right, it's very similar to how we work with a singer. You know, you're projecting the voice from your diaphragm and trying to keep the throat muscles out of the way. So ideally, when you project, you should not feel anything in your throat.
Okay.
Ideally. So we work a little bit on that.
Great.
Yeah.
And we have some Facebook Live questions. Again, we're talking about vocal problems with Dr. Fletcher, laryngologist at Johns Hopkins Voice Center at GBMC, and speech language pathologist Melissa Bidlack from the Johns Hopkins Voice Center located at GBMC. And I believe we have some Facebook questions which we're going to have presented to us in just a second on our whiteboard, which will be making its way towards me shortly. Also, oh, this is a good question. And Valerie wrote in, she was going through post-menopause and how she can care for her voice after that and as you continue to age as well.
I think I can start with that a little bit. You know, certainly we do know that the hormonal changes affect the vocal folds. I mean, we all see that with especially with boys, you know, their voice changes, but even women definitely have estrogen and testosterone receptors. So, you know, one of the things we do see sometimes is the effect of hormone replacement and the effect of lack of hormones. They're all there, and, you know, you control it as much as possible with all, you know, other symptoms that their primary care doctors are trying to manage with medications. So, you know, we recognize that and at least tell folks, look, you know, those do have changes. I think the hydration is part of, a really big part of it, as we were talking about earlier. You know, I may ask you if you have any other technique things.
Women even feel the fluctuation. Some people are very sensitive even during the menstrual cycle, right?
Right.
Before menopause, then when the estrogen and progesterone peak at different levels, I think they peak about day 14 in the cycle, and we notice the sort of sloughing off of the tissue, and then it starts to go down, and so people notice changes in how their vocal folds are vibrating, usually higher level singers. And then when they start to go into menopause, there's fluctuation of those hormones, and they start feeling like thicker, they lose some range, drier, as you mentioned, right?
Correct.
Thicker mucus. So especially for a singer, it can be a little bit traumatic because they don't have the same voice they've had. So as we all age, our vocal folds atrophy as well, so we lose muscle mass, right? And it'd be harder to come together. We feel air escaping, the voice might get a little raspier, and then couple that with hormonal changes. The things I tell people, really manage the mucus as you age, really manage the dryness, right? Lots of water, like you said. And then actually a vocal conditioning program is really important. We see a lot of people who've retired and then start to notice they're having some voice problems. And sometimes it's just they stopped using it as much, right? So doing some daily warm-ups, reading aloud, singing along with the radio in a comfortable range. Those are things you can do to keep your voice going. And so when I have singers coming in who are going through menopause, we work on recognizing what the system's doing now and sort of tailoring exercises to keep them conditioned.
Great
And I think going back to the medicines on those, one of the things sometimes and I have seen is that when we were talking a little about hormones, you can have testosterone effects to the voice, so they're a little bit unusual and not even predictable, especially if they get replaced. So sometimes we'll see women that will get testosterone replacements after menopause to control symptoms, and it will do just like what you would expect. It can lower the pitch of the voice, and just the care there is that those changes will not reverse.
That's right.
And so, you know, it's not a reason not to manage it in that way, but it's also a recognizable thing that when patients ask us those questions, we have to be frank and say, you know, you were trying to do one thing, and we can work around that a little bit, but some of those things are affected in that way. So.
And Vanessa just asked, if a female naturally has a deep voice, is there any way to change that? Whether they want to do that for, you know, singing quality or speaking quality? So,
you know, there's certainly the physiologic side of it, you know, definitely everybody's different and hormones are different, and so is the deepness related to the fact that there is bigger, thicker vocal cords, which is generally what you see in men, or is the deepness related to how they're using your voice, which is probably one of the more common things we see. And you know, many of our vocal problems we manage aren't nodules and lesions; they are technical issues. So you know, we can all change our voice and do different things with how we manage our airflow, and that's where we bring in Melissa and her team, because that is a way that you can improve upon those things. So that's really helpful. And then we had another Facebook customer write in. Melissa said, "Is it better to speak in a whisper or a harsher tone, or which one, I guess, does more damage, or if at all, what's recommended?" Well, I think it depends on what the problem is. I think you ask any of us don't whisper when you're sick and you have laryngitis. And the main issue there is that whispering, you know, is a process by which we keep our vocal cords apart in a way that you don't allow them to vibrate. What you're really doing is actually not talking with your vocal folds or cords at that time. And then the more you do that, the more you strain the system, you end up with these sort of maladaptive behaviors. At the same time, you know, we would just say, look, whatever comes out, let it come out, don't force it. But also, if there's not much there, then we would just say, it's better to just not talk at all.
Don't push your voice when you're sick if you can help it.
Oh, that's good advice too.
And that's a very common complaint, you know, and the very common story with, you know, we call it dysphonia or hoarseness, is I was fine until I had a bronchitis or I had something, and now 3 months later I'm not sick anymore, but my voice doesn't sound quite right. Yeah. And you can always trace things back, just like the detective work. You're like, well, you know, okay, well, that was where your problem started and why. And a lot of times it's just maladaptive behavior from that, dealing with that illness.
Right, right. Vanessa has another good follow-up question. PC, I don't know what that means. Does
PCOS, so
what is that?
So PCOS is called polycystic ovarian syndrome.
Oh, okay. PCOS.
I mean, I'm a laryngologist, but
right. So you know these acronyms.
But at the same time, it's not something we manage directly. But at the same time, yes. I mean, you know, when you look at this as it somewhat goes into the same ideas with the hormones. You know, you tend to have fluctuations. There tends to be an estrogen insensitivity within those syndromes, so patients tend to struggle with issues. So we see some of the same things we see with variability in hormonal changes. And so certainly, you know, when we work with our obstetricians, gynecologists, when they're managing that, as that is managed, and also the endocrinologists do a good job with that, we certainly see that it impacts on our ability to help with the voice. But it is in those same ways. You know, it is in hormonal impact, volume, edema, swelling of the vocal folds, things like that.
Great. And then do lung issues like asthma affect your voice? Was another follow-up question we got on Facebook.
Big question.
It's a big question, and I think absolutely. You know, going back to how the vocal cords work, I think everyone thinks that their vocal cords just are there to generate a voice. But really, the primary aspect of our voice is our breathing and our lungs, and so
it's our power supply.
It's our power, you know. So we always use these. I don't think folks can see the guitars here, but you know we think about.
Hopefully they can in the background.
On stage. But you know we think about the voice as a musical instrument, and if you think about it that way, your power stroke on strumming the strings is what gives drive to the vocal folds to create that good vibration. So if you strum half-heartedly, the sound's not going to be the same. And it's not just that, you know, once there's reduction in flow, then you're going to tighten everything up here to get the same level of projection, which then leads to more trauma. And it can be just this spiral, then that gets made even worse by the medicines that get used to treat the lung problems.
The side effects.
So inhalers and so, you know, sometimes, you know, it's one of those things that, again, you have so many additive things, and we see a lot of folks that they get their lungs fixed and their voice gets better, you know, and so it's paramount.
Right. Can you do any kind of, Michelle writes in, can you take any sort of voice training for more effective public speaking, even if it's not part of your career to do that? Say you have a big presentation coming up.
There's a big executive field for training the voice, right, where people have built full companies on this. They go around and train corporate members, right, to make public presentations and learn how to use their speaking voice effectively. Absolutely. There are a lot of speech pathologists out there doing this.
Great. That's good to know there's help out there for sure. And speaking of, what can you do if somebody's watching our Facebook Live today and they think that they need help with their voice? What's their first step to get that help?
I'll try to see a laryngologist who specializes in the voice and has a special equipment, which is going to sound wordy, video stroboscopy, so we can look at how the vocal folds vibrate. Of course, you can always start with your otolaryngologist, right, your general ear, nose, and throat doctor, and if you need more specialized evaluation, they may send you to a laryngologist.
Great.
And even before that, just seeing, keeping good health and seeing your general practitioner.
Right, right. Maybe bring that up with them, and they can, will they oftentimes refer patients to specialists like you too?
Correct.
And it's important to note, some people ask us, you know, how long should I wait before I go to get my voice checked out? And in our world, dysphonia is what we call a voice disorder, something that persists longer than 2 to 3 weeks. So if you're noticing changes and symptoms that are not improving after that time frame, and you don't think it's related to other issues that need to be, like you said, allergies before, then it's time to get it checked.
Wow, allergies, asthma, we've covered a lot too. And also, next up, cysts on the thyroid. Can that affect vocal cords as well?
So, you know, when we think about cysts on thyroids, you know, if you look at, I think a lot of folks have the idea that their thyroid really has a huge effect on their voice. It can, but your general cystic thyroid, which is very ubiquitous, I bet if you ultrasounded everyone in this room, there'd probably be a cyst or two you would pick up.
Wow.
Very common things we see. So in general, that by itself should not be a specific bearing on the voice. You know, so we don't say, okay, you got a thyroid cyst, that's the answer for your voice problem. So it's unusual. Now, can thyroid problems lead to voice problems? Sure, but a specific, you know, cyst, not really.
Okay. And we hear, going back to celebrities suffering from vocal hemorrhaging and things like that. You know, like Adele, or specifically, actually she had to cancel some shows recently. What would be the signs and symptoms of that condition when it gets that serious? How will you know it gets to that point?
The sign of a hemorrhage is sort of an immediate change in voice. Some people will say they feel a popping, feels like a veil crowding the vocal fold as it actually is filling with blood.
Oh, wow.
From a burst blood vessel. And so that increases the mass of the vocal fold. It makes it really hard to vibrate. And then you lose range, you sound extremely raspy, but it's the sudden onset that's the hallmark of a hemorrhage, and the sudden voice change.
And a lot of those folks will say that they started having some problems leading into it, that they were sort of getting around. And if, you know, we always say we'd like to have known exactly what they looked like as they moved along, but sometimes that's development of these sort of enlarging blood vessels, maybe even small little polyps. And again, that's a reason not to kind of discount these little warning signs, because you'd much rather catch it as a little blood vessel or a little polyp. You do some of these, you know, therapeutic endeavors, make things better, and then that'll never happen as far as a bleed. The biggest issue with bleeds is that you just keep moving through them. You know, blood is very, you know, it's very irritating, and the more that happens, and if it happens over and over, scar tissue develops. And that's when we start looking at things that are harder to manage. You know, vocal cord scar, diminished vibration. I think if you ask everyone in my profession, you know, the holy grail is figuring out how to fix scar and figuring out how to improve vibration. And there's lots of people trying to figure it out, and so far it's hard. And so, so you, just like anything else, it'd be better to not get there rather than have to deal with it later.
But these people are the vocal athletes, right, of our world.
Yeah,
they're,
they really
the marathon runners, so they're asking their voice to be consistent across travel, illness, you know, back-to-back performances of extremes. So they're more at risk, right? And it's going to happen
for sure.
And they're being pushed, and so it's hard. You know, I think one of the things that we definitely all understand is that, you know, when the prize athlete hurts his shoulder, everybody's fine with him getting rehab, and his contract still keeps going because he's going to be better next year. The problem with the singers is that, well, their contract may not be there, and so there's a lot of stress, and it's really within our fields is a big movement of trying to kind of open eyes on many levels, trying to figure that out. And I think if you would ask many of these performers, they really do feel the stress to keep it going no matter what. And even if we advise them in some ways, it's very difficult to, hey, look, we're canceling your tour, right? And that's, so I think to us, that's one of our big challenges is education. You know, so hey, look, we want these people to be singing for us for decades, not just a year, and then, you know, they've hurt themselves.
It's a very good point. So maybe we, even as just fans of music, and can be more mindful of that. Like John Legend recently canceled at Merriweather Post and rescheduled, but it was due to vocal problems.
Be happy for them. Say, wow, that's really good for him, and for, you know, rather than, you know, hey, look, I'm frustrated that I'm not making the concert. You know, obviously they would not be making that decision unless they're being counseled very well, and it's hard for them to do, for sure.
And then you can reverse some of that damage before we don't want to lose our star performer.
We don't want to push through.
And you're very good point about the athletes too, because we can look no further than Joe Flacco's back injury, which everyone's being patient about. But obviously, we know how difficult back injuries are as well.
Absolutely.
The last thing he wants to do right now is play under that condition. I'm sure his doctors are advising him to do exactly what he's doing, which is to sit it out, and we have to kind of be patient along with him.
Right, and it's repetitive stress. The pitcher with the shoulder injury and the
Yeah,
a
right.
series of surgeries, right? You know,
the
over and
range of
over.
motion, and also we'll make sure not to scream too loud when he finally gets back on the field, if we've learned anything at all today, right? And here's another question from Alyssa. This is a good one. Does persistent acid reflux have long-term effects on vocal cords?
So I think that this is a big question we get with regards to reflux in the voice. And I think it's gone through some metamorphosis over the last few years. I think at one point it was seen as a very high-level cause for hoarseness. I think in some realms it is still addressed as that way. I think one of the things we are recognizing, though, is that reflux itself may be playing a role, but it may not be playing the whole role. So certainly managing it, you know, with, you know, frank, you know, stomach, esophageal symptoms. But I think one of the things we would caution is that outside of those symptoms, if you're having persistent throat problems and reflux management is not helping, then we would argue that, well, maybe reflux isn't the whole story. It may be part of it, but maybe there's some other things going on.
Good point. Well, I think you covered so many different things today to help people be mindful of voice problems, how to avoid them, how to treat them. And we want to thank you guys and keep those questions coming in. If we notice them at facebook.com/GBMC Media, which we will, we'll be sure and get back to you. And unfortunately, we couldn't get to all of them today because we had so many. I think we helped a lot of folks, though, for sure. We want to thank again Dr. Kenneth Fletcher. You can find him as head of the Division of Laryngology at GBMC and also as a laryngologist, as he had said, at the Johns Hopkins Voice Center at GBMC, working oftentimes alongside, in tandem with speech-language pathologist Melissa Bidlack from the Johns Hopkins Voice Center, located at GBMC. Thank you both so much for sharing your expertise and helping a lot of folks out there today.
Thank you, Gina.
Thank you.
Thank you.
We look forward to our next Facebook Live with our friends at GBMC. Thank you also for tuning to today's 101.9 Morning Show. I'm Gina Crash. Thank you for joining us, and keep those questions coming in at facebook.com/GBMC Media.